While this is not included in evidence-based practice, I think it's an important concern that you may have people coming to you at times who may be considered to have a spiritual emergency, which may require a different approach. So I just wanted to share a little information about what spiritual emergency is and give you some sources that you might look at to determine if it's something you may need to use perhaps in the future. The DSM-5 continues to have this religious or spiritual problem, which is a V code, found, I believe, on page 725 of the DSM-5. And basically it states, it was developed based on literature regarding the frequent use of religious and spiritual issues in clinical practice, because for years clients have brought these issues, but there's been great hesitancy at different times as to whether or not to include this in clinical practice. So the impetus for this change came from the transpersonal clinicians concerned with spiritual emergencies, and these would be people that they have been seeing in their practice. The actual verbatim DSM criteria is as follows on page 725 of the DSM-5. This category can be used when the focus of a clinical attention is a religious or spiritual problem. Examples include distressing experiences that involve loss or questioning of faith problems associated with conversion to a new faith, or questioning of spiritual values that may not necessarily be related to an organized church or religious institution. So this covers a range of issues that affect occupational and social functioning. So the rationale for this category as it was developed emerged from a survey of psychologists who reported that 60% of their clients expressed their personal experiences in religious language, and 1 in 6 presented issues that were directly spiritual or religious in nature. Again, the survey indicated 29% of the psychologists agreed that religious issues are important in the treatment of all or many of their clients. So getting back to some definitions associated with this concept, what may be termed psycho-religious problems, which include experiences that a person finds troubling or distressing, and that may involve the beliefs and practices of an organized church or religious institution. And oftentimes people who have experiences, perhaps mystical experiences, which are in conflict with the teachings of their church can certainly trigger this kind of problem. Again, psychospiritual problems are experiences that a person finds troubling and distressing and that involve that person's relationship with what might consider or construe as a transcendent being or force. Some people call this God, some people call it a higher power. And examples of this are near-death experiences and mystical experience. Oftentimes people go to spaces and near-death experiences on the other side, so to speak, and aren't experiencing what they were taught by their religious beliefs or religious institution, which sometimes causes people to be confused. And then the transpersonal perspectives have been developed. Roberto Assagioli from Italy noted the association between spiritual practices and psychological problems, and the theoretical approach, or his method of psychotherapy, he labels psychosynthesis. And I have several of his texts. There are 2 with the title Psychosynthesis in the heading. And then the Grofs, Stanislaus Grof and his wife Christina, coined the term spiritual emergency to identify a problem of psychological difficulty, particularly those associated with Asian spiritual practices that emerged in the West. There is little in theory that is useful in understanding spiritual problems. However, there has been extensive knowledge developed at the case level. Despite the disrepute in which case studies are generally held, they are a primary mode of transmitting knowledge, and applying general to specific as a way of testing out ideas related to various subjects, including this one, of spiritual emergency. So what are some of the types of spiritual problems, or religious problems, that people may experience? One would be possibly a change in denominational or relationship or membership, or a conversion to a new religion, intensification of religious belief or practice, loss of faith through some experience that leaves the person troubled or confused, joining or leaving a new religious movement or cult, or other problems that are of a religious nature that may emerge in a person's experience. Spiritual problems would be, again, loss of faith, near-death experiences that people have that leave them changed perhaps in some way, mystical experiences, Kundalini yoga practice, shamanistic crisis. Apparently, shamans always go through some sort of physical health crisis at the time of their initiation or around that time. What's called a psychic opening, experience of past lives. Interestingly, in a number of, in recent years, there have been what they call the indigo children. These are children that are relating to their parents' experiences they've had not in this life because they're from a different time, which may be construed as past lives. It's an interesting area of study that one university has been looking at for some years. I forget which one exactly it would be, but you might, if you're interested in this sort of thing, Google it. Then what's considered possession, like demonic possession, meditation-related problems, separating from a spiritual teacher like a guru. Other spiritual problems or serious or terminal illness may also trigger this kind of experience. So spiritual problems, as it's defined in the DSM-5, is also at times associated with other disorders. Perhaps it could be concurrent with substance abuse, some sort of psychotic disorder, a mood disorder, what might be considered a dissociative sort of experience and dissociative disorder, and with obsessive compulsive disorder. So those are some of the associated DSM-5 diagnoses that may be associated with this. Mystical experience, and I'm beginning to look at defining what that term means. The mystical experience is transient. In other words, it's marked by feelings of unity, harmonious relationships to what may be considered the divine, and everything in existence, a sense of euphoria, a noesis, again, access to hidden spiritual dimension, loss of ego functioning, alterations in time and space perception, and a sense of lacking control over the event. So, mystical experience. 30 to 40% of the population have had a mystical experience, suggesting that these experiences are perhaps more normal rather than pathological in terms of their phenomenon. In some cases, mystical experiences can be disruptive or distressing. And so I think, here it's important to look at psychosis versus mystical experience. They're somewhat similar in terms of the out-of-controlness, perhaps, of what may be going on. Mystical experiences tend to have more of a positive direction with them, whereas psychosis, sometimes people hear command hallucinations, which suggests that they do something to harm themselves. So they're different, and at times I think some people are confusing them in their diagnostic workups of individuals who may indeed be having an authentic spiritual experience or mystical experience of some kind, or as we call it, emergency, versus a psychotic break or some sort of pathological element. Then the near-death experience, much research has happened around this since Life After Life by Moody and Kubler-Ross, some of Kubler-Ross's work, Elizabeth Kubler-Ross. But basically, one is pronounced dead, near death, or who is resuscitated. This includes dissociation from the physical body, strong positive affect, and transcendental experiences. Some people describe this experience as observing a cord connected to the navel area of the body, which keeps them connected to the physical world as they're floating above that area. It's not always the experience, but that's some of what's been reported by a number of individuals. There appears to be stages to this process: peace and contentment, detachment from the physical body, entering a transitional region of darkness, seeing a brilliant light, and passing through the light into the realm of existence, to another realm. I experienced some of this element when I had a serious health crisis in 2008, and I was in the I was in the intensive care unit for 4 weeks. And at that time, my experience involved my finding myself facing a fog by a huge boulder that was like twice my size as I was standing there. And my father came and took me across the time-space continuum, as I call it. Again, I moved from this world across into the fog. I was into the fog quite a while, and I wasn't fearful or anything. And the fog was pretty white and light. It wasn't particularly of a dark area. And I don't recall much in terms of the other realm, but I asked my father at the time if he would assist my older sister, who was dying at the time as well, and in her transition. Many of you may have had near-death experiences or know of someone in your family that has. Again, one who, okay, this is a repeat. I guess I have two of the same slides here. Again, I'm sorry. There's leaving a spiritual teacher or path. A strong teacher has, some seek psychotherapeutic help, particularly if they were abused by the teacher. Destructive spiritual leaders may engage in brainwashing techniques that make it near impossible to disentangle them from the teacher. And again, spiritual emergency is kind of juxtaposed against what one may call gradual unfoldment of spiritual potential as one goes along life's path, with a minimum disruption in psychological, social, and occupational functioning. Whereas when one is triggered into a spiritual emergency, this can bring significant abrupt disruption in psychological, social, and occupational functioning. It sort of debilitates people depending on the depth of the experience. Spiritual emergency is a kind of birth pang in which you yourself go through to a fuller life, a deeper life in some areas in your life that were not yet encompassed by the fullness of life, are now integrated or called to be integrated or challenged to be integrated. I know after my experience with my father in 2008, I realized that I had let a lot of things in life trouble me that were just absolutely not worth the time or effort, and I now awaken every day grateful that I'm still alive and still able to function in fairly good health. Other people have different takes, but normally the experience doesn't come without some sort of change in how one looks at life. Conclusion of Luko and Francis's work, they talked about religious problems have received much more attention than spiritual problems, as we know, and there are no journals focused specifically on spiritual problems. So that's something that one of you may in the future decide you want to initiate. Then again, spiritual emergency when transpersonal transformation becomes a crisis. Again, from the work of Grof and Grof. The inner map of spiritual emergency. First, it's biographical. It's closely related to someone's personal life history. Something happens that triggers one into this awareness. Death and rebirth, sometimes the close relationship to trauma or biological birth can have some element of this. And transpersonal experiences are images and motifs that seem to have a source of origin outside of the individual, a connection to something beyond the present. Again, assistance in spiritual emergency. It's important that we move away from the concept of disease, acknowledging the healing nature of crisis. Because you know, the idea of crisis, if you use the Chinese characters, it's danger and opportunity, the interesting kind of concept, and that is really what we're talking about. The focus on support networks to assist individuals transitioning through an emergency is an important possible connection for people, and maintaining a list of resources like AA might be helpful. Certainly AA is not the only one, but as an example. Again, if the process becomes overwhelming and seriously interferes with daily functioning, then more specific therapeutic measures must be taken. It is important to make sure that a recent medical treatment has been completed. So, if there's some sort of medical trigger to this, or perhaps one may want to have a medical workup to determine if there's other things contributing to the experience. And then, of course, Gestalt practice, psychosynthesis, Jungian, neo-Reichian approaches, and sand play therapy have been shown to have some effect in working with individuals with spiritual emergency. And Stanislaus Grof developed what he called holotropic breath work. You might look at that at some point too. It's a therapeutic approach that you probably won't find in the text that we're looking at this semester. And to slow down the process, one should temporarily discontinue all meditation or other forms of spiritual practice. So if this is triggered by meditation, or potentially one wants to cease having clients practice these sort of experiences until such time that it's determined that they've returned to some sort of stable foundation, so that more pronounced symptoms may be averted. Just kind of, again, a brief overview to let you reflect on the fact that you may see spiritual emergency in your office versus some sort of pathological or psychotic experience. And so it's important to kind of begin to assess these kinds of questions that you might look at as you enter your practice.